Thank you for joining today's educational webinar with Cancer Support Community Los Angeles. I am Abby Espinoza, the Program Coordinator at CSCLA, and I'm honored to welcome you to this week's webinar titled Survivorship After Cancer, Now What? Before we begin, if this is your first time joining us, Cancer Support Community Los Angeles is a premier nonprofit organization providing vital social and emotional support to families facing cancer, including patients, caregivers, and their loved ones, all at no cost. Our programs include support groups, healthy lifestyle classes, social activities, and educational programs such as this one. If you would like to learn more about our services or watch past webinars, please visit our website at cancersupportla.org. Before I introduce today's speaker, please note that your video and microphone are automatically disabled for this webinar. Please enter questions for the speaker into the Q&A feature found at the bottom of the Zoom window. Questions will be answered at the end of the presentation. We may not be able to get to all of your questions today, but we'll get to as many as possible. Please use the chat feature to share comments and resources with other participants or to ask questions of CSCLA. We ask you to limit chat comments to information relevant to this topic. Dr. Priya Mitra started her career in internal medicine and then transitioned to radiation oncology in 2007. She currently works at UCI Medical Center and treats all cancers with a specialized focus in women's cancers. It gives me great pleasure to welcome today's speaker, Dr. Priya Mitra.
Good afternoon. Let me share my slides. All right, are you able to see my slides?
Yes, we can see them.
Perfect. Thank you very much. All right. So today's topic is survivorship after cancer. Now what? So the plan for today, my overview of what we're going to talk about is just we'll go through an introduction. We'll talk about general survivorship principles, talk about preventive health, mental health, and we'll have some Q&A time. If you have questions as I'm going, feel free to message them in the chat. I'm happy to answer them as we go through the slides. And alternatively, we can also discuss at the end. So just a little bit of background. Thank you for the kind introduction. My name is Priya Mitra. I am a physician. I did my initial training at Boston Medical Center where I studied internal medicine. Then I subspecialized into radiation oncology at VCU in Richmond, Virginia. And then I worked for almost 10 years in Einstein Hospital in Philadelphia. And then I moved to USC, where I worked for a few years, and I'm currently at UCI. So general survivorship principles. A lot of these slides that I'm sharing with you today come from our NCCN guidelines. So what that stands for is basically our National Comprehensive Cancer Network. And so what that is, basically, these are our guidelines that we as oncologists reference on a regular basis. So these are updated regularly. This is from February of 2025, and they have a whole set of guidelines on survivorship, which I found to be very helpful. So what is the definition of survivorship? It's an individual who's considered a cancer survivor from the diagnosis through the balance of life. These include survivors living with cancer and those free of cancer. The panel that was assembled for these guidelines recognizes that not all people with a history of cancer identify with the term of survivor, but these guidelines are meant to be inclusive and use the word survivor to describe anybody who's had cancer in the past. And these guidelines, the purpose of them is really, as I've underlined here in blue, is to include the potential impact on physical and mental state, health behaviors, professional and personal identity, sexuality, and financial aspects of life that cancer can have. So the objectives of survivorship care. So I guess a little bit of background. So as was mentioned in my introduction, I started out as a generalist. So I used to treat all types of cancers, so head to toe, brain tumors, throat cancers, lung cancers, gynecologic cancers, stomach cancers, foot tumors, just a variety of cancers. And I've developed a more specialized focus on women's cancers. But in general, in the world of oncology, we all pay attention to survivorship. And there's been more and more attention on survivorship because more and more people are surviving cancer and going on to live longer, healthier lives because our cancer treatments have also evolved to become better and better. So the goal of survivorship care, a lot of hospitals have survivorship clinics, and the goal is that not only do they provide surveillance to rule out recurrence disease, they also screen for new cancers. We're also trying to prevent and detect late side effects from the cancer that they had and prior cancer treatment. We also provide coordination of care with primary care physicians and other specialists and promote healthy lifestyle habits. So from the guidelines again, the recommendation is to have an assessment by a healthcare provider. It could be an oncologist or primary care at regular intervals. And what we're looking for is a periodic assessment at least once a year for all survivors to figure out if there's any ways that we can help intervene to promote better health. And I'll show you some questions and surveys that we use as references to help guide us in terms of how to better care for survivors. And it's a combined effort. It's not just one physician, but it's a whole team that we work together. And the care providers we're supposed to assess these 10 things. Current disease status. Does the patient have evidence of disease or do they not? What is their functional or performance status? Meaning, do they need help with cooking meals, with getting dressed, with taking showers, or are they pretty independent and functional? What medications are they taking? Are they on supplements? Are they on antioxidants? Comorbidities, are they, what are their other medical conditions that could be potentially influencing things? For example, are they a survivor that's on medication that could cause diabetes or could interfere with diabetes medications or elevate somebody's blood pressure? What prior cancer treatment did they have? What types of treatments did they get? What's the family history of cancer? Psychosocial factors, is there a history of substance abuse, of trauma? Could that be factoring in? Weight and health behaviors can also affect the risk of having cancer recurrence, another cancer, or affecting other medical conditions. So, for example, tobacco and alcohol use can have an impact. Fertility concerns are definitely something that we deal with on a regular basis because a lot of women that I see, for example, are of reproductive age and they're having to grapple with these questions of, do I want fertility preservation or how is that going to be affected by cancer treatment? So survivorship concerns just kind of summarized here. So cardiac health, making sure that their heart is healthy, managing anxiety, depression, trauma, and distress, cognitive functioning, making sure that patients are functional, meaning able to perform their day-to-day routine, perform at their job if they're working, assess the level of fatigue, assess lymphedema, which is basically typically arm or leg swelling as a result of cancer or cancer treatment, assess pain. Sometimes we'll refer patients to the pain clinic or pain specialist. Hormone-related symptoms, especially like did we induce menopause, early menopause in a young woman? How should they be on supplements? Should they not be on supplements? Sexual health. A lot of people, men and women alike, can have side effects from cancer or cancer treatments that can affect sexual health. Fertility, we talked about briefly. Sleep can be interrupted. Promoting a healthy lifestyle. Making sure people are getting immunizations and not getting any infections. And then what's the status of their job? Is working important to them? Are we able to help them return back to work? This is a very busy slide. I'm not going to go through it, but I hope that you can just see on the left are the categories that we just went through, survivorship concerns. So this is just basically a survey that we can use with patients that address all those survivorship concerns. So I'll go through a couple examples. So fatigue. Do you feel persistent fatigue despite a good night's sleep? Pain. Have you had any pain in the last week? How would you rate that pain? Sexual health. Do you have any concerns regarding your sexual function, sexual activity, sexual relationships? Are these concerns causing you distress? Maybe somebody's not sexually active, but that doesn't bother them. So that's something that we can, put on the back burner and address other issues that they may be having. So based on each of the survivorship concerns, if somebody answers yes to the questions that were outlined there, if yes, they have extra special guidelines for each of these categories, which is super helpful. And I'm happy to pull these up if anybody's interested in reviewing any particulars. But I just wanted to highlight that we do have guidelines on these topics in a way that we can help improve their concerns. Any questions so far before I move on to preventive health? Okay, so then I'm going to keep going. So preventive health is an important component of survivorship and what we do after somebody has been through a cancer diagnosis and treatment. I love the fact that a lot of patients have, should hopefully feel empowered. There's a lot. I mean, everything that's listed here is something that's in your control, right? The level of activity that we have in our lives, our nutrition is in our control. Sleep, I understand sometimes, we can struggle with sleep disturbances, but, there's things that we can do. And we're going to talk about things like sleep hygiene, some tricks that you can use that can potentially help improve your sleep. Alcohol use, how much we're intaking, tobacco use. Again, all of these can impact our health, and these are all in our control. Sun safety, using sunscreen, weight management, making sure you're followed up with your primary care physician, getting health screening, and managing our stress. So let's talk about physical activity. So the guidelines break it down into 3 different types of activity, physical activity. Light exercise, moderate exercise, and vigorous exercise. So listed below are some examples. Again, I'm not going to read through, but it's really just here for reference. So light exercise, you don't really have a change in your breathing pattern. So bowling, light housework, restorative yoga, going for a walk, tai chi. These are just kind of normal light activities that you can do that is active, but it's really mild. Moderate exercise, you can talk, but you can't sing. So for example, doubles tennis, gardening, more intense yoga, pickleball, Pilates, a brisk walk, water aerobics, again, more active, getting your heart rate up a little bit higher. Vigorous exercise, you can say a few words without stopping to catch a breath. So going for a run, biking faster than 10 miles an hour, dancing, boxing, running, pickleball if you get really intense, martial arts. I just saw a patient this morning who does Brazilian Jiu-Jitsu, and it's a very, from her description, a very vigorous type of exercise. Swimming, lots of laps. These are all, I think this is mostly intuitive, but just wanted to highlight this because it ties into the guidelines. So the general principles from the guidelines on survivorship of physical activity for cancer survivors. Survivors should strive for at least 150 minutes of weekly activity with the ultimate goal of 300 minutes or more of moderate intensity. So just to go, or 75 minutes of vigorous intensity. So I'll go back to this. So 150 minutes of moderate activity or moderate exercise. So that's about 2.5 hours. So which is about on average 30 minutes a day for 5 days in a week. So, I think a lot of people discount walking. Even just going for a walk can be super helpful. Gardening, tennis, baseball, volleyball, biking on level ground. So if you can try to get in about 150 minutes, about 2.5 hours a week, that's the goal. Alternatively, you could do vigorous exercise, as we talked about here, for 75 minutes a week, which is, honestly, you go for 2 days, you can run for 2 days, about a half hour or 40 minutes, and you've met this criteria. The goal is also to engage in 2 to 3 sessions per week of strength and resistance training that includes major muscle groups, stretching those muscle groups before exercising, and at least 2 days a week that exercises on those muscle groups are not performed. So basically alternating, not overdoing those muscle groups, and trying to incorporate core exercises and balance training is important. Now, listen, I completely recognize I don't even necessarily always meet these goals every week. I try. And I think that's kind of the take home. These are just guidelines. These are not meant to be, if you can't meet 150 minutes a week, then, you're in trouble. It's not that at all. But I think these are nice goals and targets that we can aim for. And I think they're doable, especially if you're, going for a run or if you're going for walks. I mean, it doesn't have to be, you don't have to necessarily go to the gym to meet these criteria. But also just to highlight here, avoiding prolonged sedentary behavior, sitting in front of watching a show and binging for, a weekend, watching something that you want to watch. I've done that too. Nothing wrong with that. The goal is just to not do it on a regular basis and just trying to be active. I don't know if any of you are familiar with the blue zones, but blue zones are pockets of the world, geographic areas where they have the highest concentration of people who live above the age of 100. And if you're interested in that, I would definitely encourage you to look that up online. There's some TED Talks and there's some books on that topic. But one of the things that they found in terms of commonalities of those cultures where these people live above the age of 100 is most of them don't go to the gym. But what they do is they bike to go get groceries. They'll take the stairs rather than elevator. It's just simple things. It doesn't have to be complicated. Okay, so physical activity, so resistance training. Again, a lot of these are just kind of in here for reference. So if you want to come back and look at these slides later, using weights that you can do 10 to 15 reps, making sure you're doing these reps but getting rest in between. You can work with the personal trainer. If you have peripheral neuropathy and you're worried that that could increase the risk of dropping weights, you may want to use machines or resistance bands instead. There's lots of ways that you can do this. People who have lymphedema, we usually refer them to occupational therapy or physical therapy, and they have specialists who can help with lymphedema, so that way that doesn't interfere with your day-to-day activity and physical activity when you're trying to become more active. So here are some strategies to try and increase physical activity. So let's say you're hearing this and you're like, I don't quite meet those numbers in that time frame on a weekly basis, but I want to do better. So you can talk to your doctor about it. You could work with an exercise specialist or a trainer. You could start to attend classes. Start small. Little changes make a big difference. Maybe if you like Zumba, try doing Zumba or putting on some music at home and dancing in the kitchen when you're making meals. There's support groups out there, there's walking groups out there that can be really, really helpful. And just setting goals, realistic goals, short-term goals. Let me go for a 5-minute walk, and that's fine. Next week, maybe go to 10 minutes, and you can build up from there. You could consider getting like a Fitbit, or if you have an Apple Watch, or things that you can track your steps. The goal is ideally to aim for 7,000 to 10,000 steps per day, if at all possible. Getting an exercise buddy, going with a partner or a friend or a child or a parent or a neighbor can really, really help the habit stick. And these are just some subspecialized considerations for certain groups I've highlighted in orange. So if you have established lymphedema, there's groups that you can work with, survivors who have ostomies. You can modify exercises that doesn't get in the way. If somebody has a limb prosthesis or limb amputation, working with physical therapy or occupational therapy can be helpful. Peripheral neuropathy, really important to improve on balance because that may increase the risk of falls. Survivors who have bone loss or bone metastases, again, trying to minimize fall risk, and older adults, in using exercises that can improve balance. But honestly, things like Tai Chi, yoga, you can have mild activities that can be really helpful. So I'm going to shift gears to nutrition, unless anybody has any questions. If you do, feel free to pop it into the chat. But nutrition, I always love this phrase of eating the rainbow. And I try and implement, once I heard this, I try to incorporate it into my own life, truthfully. So eating the rainbow is basically where the goal is on a daily basis, if you can, to try and eat one color from the rainbow, one color each. So for example, red peppers, an orange or tangerine, corn, spinach, blueberries, eggplant. Now listen, I completely agree it's challenging to do this on a daily basis, and I do not do this on a daily basis, but I strive for it. Another frame of reference, the USDA. These are, this is kind of how your plate should look on a given meal. So fruits and vegetables should be half the volume of the food on the plate. Now, and if any of you have seen this plate graphic before, it used to be very different. Before, it used to be protein was almost half the plate, but it's evolved over the years. So now that the goal is vegetables and fruit should be half the volume. And I think eating the rainbow can be very helpful, especially if you've got a salad, you throw in lots of fruits and vegetables as half of your plate. It can be really easy to fit in a lot of colors. Whole grains, about 30% of the plate, protein, about 20% of the plate. So let's go through some examples of what does that mean. So recommended, again, from the guidelines, recommended sources of dietary components. So they also talk about, fat, there are healthy fats. So plant sources such as olive or canola oil, avocados, seeds, nuts, cold water fish. Carbohydrates, so things that they would recommend would be fruits, vegetables, whole grains, legumes, or lentils. Protein, poultry, fish, legumes, low-fat dairy foods, eggs, and nuts. One thing, hopefully, I don't know if anybody's noticed, but there's not red meat on here. And kind of going back to touch on the blue zones a bit, one of the diet commonalities between those different blue zones was a Mediterranean diet or plant-based diet. So basically, trying to avoid red meat. You don't have to be vegetarian, but eating, more, less meat and more of the other stuff is very beneficial. This is a common question I get asked. while talking about soy products, especially for cancer survivors, it's been a matter of debate for many, many years. Most studies to date show that moderate consumption of soy foods, up to 3 servings per day, can be beneficial in promoting overall health and survival. Um, that being said, I think like anything, moderation is key. I wouldn't eat soy every day, every day, all the time, but I think moderation is fine. So the nutritional goals that are recommended, predominantly plant-based diet, including lots of veggies, fruits, beans, whole grains. Monitor your portion sizes and caloric intake. It's also been studied that the more people we eat with, the higher our portion sizes go. So if you're eating by yourself, as opposed to eating with one other person, as opposed to eating with the family, as opposed to eating with a group of friends, the more people at the table correlates typically with larger portion sizes. We're more likely to go back. It's a social thing. So just trying to be mindful of your portion sizes when you're sitting down to eat, especially in a group setting, can be very helpful. Be very cautious with intermittent fasting. It is something that is very successful for many people, but you have to be careful. It can trigger dizziness. It can trigger lightheadedness, especially if somebody's diabetic. So, I am a fan of it, but I do think it has to be done with caution. Ideally, talk to your primary doctor about it. Talk to a nutritionist or a dietitian about it, and they can guide you with some principles. But you can try little things, like not eating super late at night. That can be super helpful. But that's something just to explore with guidance. So the recommendations also include limiting the following. So red meat, ideally less than 18 ounces per week, trying to avoid processed meats. A lot of them have carcinogens in them, so cancer-causing chemicals. So I personally stopped eating the processed meats if I can help it. Chips, cookies, candy bars, sugary foods, all the good stuff. Again, it's fine. I indulge as well, but trying not to do this on a daily basis if we can. Refined sugars, ideally less than 25 grams for a 2,000 calorie daily diet. So what does that mean? So they want less than 6 teaspoons. So yeah, you can have a cookie by all means. A 12-ounce a can of soda is 10 teaspoons of sugar. So, it's better to eat a medium cookie rather than have a can of Coke or Pepsi or Sprite. So just be mindful of the labels, nutritional labels. Moving on to alcohol. So the goal is to drink sparingly if possible. Normal intake varies in terms of what's considered normal for men versus women. So females, 1 drink or less per day. For men, 2 drinks or less per day. The goal is to avoid binge drinking, and these are the definitions for binge drinking. 4 or more drinks in one sitting is considered binge drinking for women. 5 or more for men is considered binge drinking. We typically recommend no alcohol if you have a history of liver cancer, esophageal cancer, breast cancer, colon cancer, and head and neck cancer. The reason is that there's been links with increased alcohol use and these cancers. So again, it's not that you need to completely stop alcohol. You can certainly enjoy and indulge, periodically, but I think it's good practice to try not to do it on a daily basis and to try and avoid binge drinking if you can. I'm going to shift gears to weight management. So I'm not sure how many of you are familiar with BMI or body mass index. What that is, that you can Google this online. It's super helpful. We're basically, on the right here is a screenshot from the website. You plug in your height, let's say you're 5 feet 6 inches, you plug in your weight and you calculate your BMI. And then there's ranges. The normal range is between 18.5 and 24.9. If your BMI is less than 18.5, you're considered underweight. If you are overweight, that's 25 to 29.9. Obesity is technically a BMI of 30 or greater. So I remember when I first discovered BMI and I calculated it, and I was very surprised that I ended up in the overweight category because I didn't feel overweight. However, it's just, it's not a perfect calculator. Some people can be healthy and just be on the upper range of normal, but it's a nice tool, I think, as a starting point where you can just kind of get a sense of where you fall. And of course, different cultures and different body types can vary, but it gives you a wide range. So it's not going to give you an exact number of a weight goal, but it'll give you a range that's considered healthy. So how do we adjust that? If we find out that our BMI is, above that range, monitoring calories, right? Portion control, we kind of touched on that. Physical activity, we've touched on that. Behavior changes, so time of day that we're eating, trying not to eat right before bed. What food choices are we making? I admittedly was indulging in chocolate quite a bit as my late night snack or cereal. So I, cut that out or didn't do it every night, and I started to see changes. I also started implementing exercise more into my regular day to day, and it really made a difference. Sun safety. So daily sunscreen of SPF 30 and higher is what's typically recommended to help protect against UVA and UVB rays. The recommendation is to reapply sunscreen every 2 hours after you've been out in the sun, swimming or sweating to avoid tanning beds, and seeking shade or wearing protective clothing if you're going to be outside for long periods of time. Shifting gears to sleep. So adults, the goal, it's interesting, the guidelines are different for age groups. So the average adult, 7 to 9 hours per night is the goal. Adolescents need more sleep, 8 to 10 hours. Older adults can sometimes get a little bit less. So similar to the average adult, but older adults can sometimes do 7 to 8 hours per night. I briefly mentioned this earlier. This is sleep hygiene, so I have a couple slides on that. I don't know if you guys are familiar with this, but sleep hygiene is a way that you can help improve your sleep habits. So if you're struggling with sleep, I would encourage you to pay attention to these couple slides. So things that can help: maintaining a regular bedtime and wake time, meaning going to bed around the same time every evening and waking up around the same time every morning, can be really helpful. Engaging in physical activity in the morning or in the afternoon, whatever works best for you and your schedule. Ideally not right before going to bed, so within 3 hours of going to bed, but some people are fine with that. But generally doing it during the day, um, physical activity can help you sleep better at night. Exposure to daytime bright light, especially in the morning. So, if you've got window shades, open them up in the morning, and that can help you kind of wake up naturally. Trying to avoid, this is a common one that I think a lot of us struggle with, avoiding bright light and screens right before bedtime. A lot of us will lay in bed scrolling on our tablets or phones or computers, but maybe try taking a break from that. Have a break of maybe, even if it's just 10 to 15 minutes between when you're on your screens and before you go to bed, and that can really help you sleep better too. Avoiding heavy meals right before bed, or even limiting fluid intake, because then it's a lot of times if you are drinking right before bed of any kind of beverage, then you wake up in the middle of the night to go to the bathroom, and that can make it harder to fall back asleep. Avoiding alcohol and nicotine right before bedtime. Limiting caffeine intake, especially in the evenings. Trying to have a dark, quiet room, comfortable temperature, not too hot, not too cold. Try not to look at the clock when you wake up in the middle of the night. I am definitely guilty of that, and I find that when I don't do that, it helps. Trying to limit naps, and if you do take a nap, not longer than 30 minutes, because that can throw things off. And turning off electronics at bedtime. I think a lot of us sleep with our phones next to us at night, and I remember I was having some trouble sleeping, so I decided to did like an experiment for about a week, and I put my phone in the bathroom, so it's out of hand's reach, and I honestly believe that my sleep improved after making that change. So that way, right before going to bed, I have a little break, can kind of unwind, and in the morning can wake up and not feel any stress or pressure by looking at my phone immediately, and just can get ready for the day. So these are some cognitive behavioral therapy techniques for insomnia. So, if you try sleep hygiene and it doesn't work, there's other things that are listed here that you can try. Trying to keep the bed and bedroom as a place just for sleep or sexual activity. For example, if you have a TV in your room, sometimes taking the TV out of the room can be helpful. Limiting the time that you spend in bed, maintaining a regular sleep schedule. Doing other things to relax, sometimes taking a shower, like a hot shower or a hot bath before going to bed, meditating, yoga. There's things that you can do to help. There's a lot of sleep meditations out there that can be very helpful as well. Sexual health. I think this is an area that honestly we as clinical providers don't talk about a lot and don't talk about enough. I've, taken care of women. In terms of what female patients is my predominant area, I do try to address this with women. Are you sexually active? Have you been satisfied with your sexual function? Are you having any pain with it? Do you feel that you are unable to have orgasm? Are you using lubricant? What's the sensation like? Is it triggering trauma? Honestly, some of the treatments that I do can trigger PTSD. So I ask about, have you ever been the victim of sexual assault or rape? And if your provider's not asking and this is a concern of yours, I would bring it up. You're completely entitled, and it's helpful for us if you do bring it up. I mean, our job is to bring it up, but we work together as a team. So I would encourage you not to be shy. And if you don't feel comfortable bringing it up with your provider, maybe with your primary care doctor, talk to your OBGYN or talk to, one of your other providers or the nurse. I mean, there's plenty of people that you can reach out to talk about this. This is just a sexual health inventory. It's a questionnaire that I usually have our patients fill out. Like when I was treating a lot of men with with prostate cancer, we would have them complete this questionnaire. It's really just here for reference. But it is important. I always ask men when I'm meeting with them, what is your sexual function? Are you sexually active? What is your sexual function like? Are you able to get a full erection or partial erection? Are you able to complete ejaculation? Is it dry? I mean, all these things can be affected by cancer treatment. So it's important for us to know the baseline, and that way we can help them manage any side effects from the treatments. All right, moving on to mental health. So I wanted to highlight a few of the mental health diagnoses, just to talk to you about the actual, like for what we learn as the definitions for depression and anxiety. So for depression, technically it usually is at least 2 weeks, more than half the time that you have at least 5 of the following. So this is not meant to diagnose any of you with depression, but just to give you some guidelines of, maybe if you meet some of these criteria or you meet a lot of these criteria, talk to your provider, talk to your family members, talk to your friends. There's help out there, and I've got some resources towards the end. But these are common diagnoses in the general public, but especially after cancer diagnosis and during the treatment phase and even after treatment. A lot of people come to me when I see them in follow-up, they feel lost because you get the diagnosis, you're going through treatment, and then treatment is done, and then you don't know what to do with yourself sometimes because you're not doing anything active to address the cancer. So a lot of patients can feel depressed. So I'll just read through some of these, but feeling depressed or sad or empty or just feeling hopeless. Your weight going in opposite directions, either losing a lot of weight, unintentional weight loss, or gaining a lot of weight. A lot of times people, we can sometimes eat our feelings, right? We don't want to deal with it, and then we just kind of stress eat. Altered sleep, we talked about sleep. And so, you try sleep hygiene and it doesn't work. Maybe there's an underlying mental health component. Not having as much energy, not being able to concentrate, thoughts of death or suicide. So if you meet at least 5 of these and the symptoms are not going away, I would really encourage you to seek out help and talk to someone. Anxiety. So excessive anxiety or worry that is difficult to control, and at least 3 of the following. So feeling restless or on edge. Again, this doesn't have to be 24 hours a day, but if it's a persistent thing, you just constantly feel like you're really, really restless, easily fatigued, difficulty concentrating, or your mind just goes blank, very irritable, muscle tension, sleep disturbance. All of these can be signs. This is not a exclusive list, but these are common symptoms that you can have from anxiety. And then the last diagnosis in terms of mental health that I wanted to touch on was panic. So panic or panic disorder or anxiety, like panic attacks. So sudden, intense fear or discomfort that peaks within minutes, and you have at least 4 of the following. So we'll go through some of these. Palpitations, you feel like your heart's pounding or it's going to jump out of your chest. Sweating, chest pain or discomfort, you're shaking. Nausea, you feel like you're going to die. You feel like you're losing control. Numbness or tingling, chill, feeling really, really cold or really, really hot, feeling dizzy, lightheaded, unsteady. If you're having a lot of these symptoms that are suddenly coming on out of nowhere, that feels like it's out of nowhere, I would encourage you to talk to someone to see if maybe you're having a panic disorder or panic attacks. So again, please, if you meet the criteria on the slides that we just talked about, please seek out help, seek out a healthcare professional. I put a number here. This is for Suicide and Crisis Lifeline. For you or a loved one, you can always call or text this number or visit their website. There is help out there. And so then really just to kind of wrap up, I wanted to just end mostly with some resources. But before we go into that, just survivorship, just in summary, survivorship is really the beginning of regaining your life back in a new way. And just a reminder, you have a lot in your control. It's important to keep up with the recommended follow-up visits and tests. There's lots of ways to maintain a healthy lifestyle, nutrition, physical activity, managing your weight to be in a healthy range, like we talked about with the BMI. Making sure we take care of ourselves, right? Mental health, sexual health, talk to your healthcare providers. We can help you, live your best life. And then I just wanted to end with some resources. So again, this is more just for future reference. I won't go through all of these. But on the left are just organizations that are out there with their websites that are listed here that you can reach out to. Like American Cancer Society is a wonderful resource. I usually refer a lot of my patients to them. Here's a bone marrow donor program, the Centers for Disease Control, Leukemia and Lymphoma Society, Live Strong, NCCN, which is where a lot of the slides from today came from. You can actually make an account. I believe you can they have separate guidelines for patients. So if you're intrigued by this, I would check out their website. And this is the link here for patients. There's lots of support groups out there. There's helplines that you can call. There's phone numbers listed here. You can call anonymously and really get some resources. Again, more resources here. Children's oncology group. So if you have a child in your life or a young adult who's going through cancer treatments, there's separate guidelines for them. Survivorship care, integrative health. I know at UCI and I think a lot of institutions, we have an integrative health program. So that can kind of be in side by side in parallel with the survivorship clinic. So they can really, if you're interested in supplements, there's a whole subset of the NIH or National Institute of Health that focuses on dietary supplements. So, that way you can be careful and cautious with what you're taking. Just a quick aside, I had a patient who came to me with prostate cancer and he showed me his supplements and he didn't know that one of his supplements had testosterone in it. And he'd been taking it for years and nobody had ever checked. And so, and we believe that's what contributed to him developing prostate cancer. So you just have to be careful with what you're doing out there. So, if you're interested in that, seek out an integrative, they have integrative oncology. So, there's lots of resources out there. If you or a loved one is experiencing legal or employment issues, there's lots of resources listed here for that you can reach out to. And then for LGBTQ individuals with cancer, there's separate organizations, women who are in menopause and struggling with sexual health issues. The OBGYN world has an organization. There's a menopause society. If you're more interested in learning about physical activity, there's resources here for guidelines for that as well. The YMCA has a program. Silver Sneakers is a great program. A lot of my older patients participate in that. It's a way that, it's kind of brings older adults together where they can lead healthy, active lifestyles, where they'll go for walks together and do Tai Chi together. And it's a wonderful program. This is just some guidelines for nutrition and weight management. And so if that's something that you're concerned about or want to focus on, you can look at these resources. Cardiovascular health, if you want to get your heart in good health or improve that, you can do that. Just a quick aside on that. A good way to measure your heart health is to check your baseline heart rate when you first wake up in the morning before getting out of bed. Normal heart rate is between 60 and 100. The healthier your heart is, meaning you're getting good cardiovascular exercise, the lower on that range it should be. So 60s is fine. You can even get into the 50s and that can be normal. But you can talk to your primary care doctor about that. Oral and dental health can sometimes be a problem when patients have mouth cancers. So there's a group that does that. Sleep disorders, smoking cessation, suicide prevention, and other psychosocial issues. The VA hospital system has quite a bit of guidelines for that as well, or groups that they can help with, hotlines, helplines. There's tons of resources out there. So my hope is that if you're interested in any of these, that you will use one of these resources to get more information. And I want to thank you all so much for your attention and joining today. And I hope you walk away having learned some information that's been helpful. And I'll open it up for questions. I see a question, two things that came in the chat. What is the purpose of intermittent fasting? So intermittent fasting can be a tool that's used for either weight loss or maintaining your weight. Basically, it's you eat in an 8 hour period. Most intermittent fasting is you eat within an 8 hour period. So, for example, between noon and 8 p.m. And then you don't eat anything outside of that. Um, and so the purpose of it, I actually started doing it because when I found out that I was overweight and by doing my BMI calculation, I tried it. And so that's what I typically do. I eat between noon and 8, and it can be really helpful for it basically what it does is it limits your caloric intake, right? So it's a way that you can um, limit it. There's also been some studies that have shown that it can actually be good for brain health too. But I'd encourage you to read about it. It's a complicated thing, but it's not for everybody. So I don't think I would tell everybody to go and start intermittent fasting. But I think if you're interested, for example, in weight loss, it might be something that might be helpful. Question here. I had ovarian cancer and finished chemo in January. Since then, I've been on maintenance therapy and I've gained about 15 pounds. I'm more active and eat well, so I'm worried about the weight gain. Doctor said it can happen after chemo and the weight will come off. Yeah, no, I mean, I definitely see this where the weight gain can happen as a result of treatment. I agree that what your doctor is saying is that it can take some time. The question I would ask yourself is, it sounds like you're trying to eat healthy and you're active. I would maybe consider, what times of days are you eating? Are you making sure you're eating healthy foods? What everybody considers healthy is a little bit different, right? Sometimes people think eating, for example, not all fruit is healthy, right? So pineapple, for example, has a lot of sugar. So I wouldn't eat a pineapple a day. I'm exaggerating, but it might be worthwhile meeting with a personal trainer or a dietitian. Maybe if your exercising is not incorporating weights, you could try incorporating weights. That can sometimes help make the body a little bit more lean, where you might give you more results, or maybe you're doing only weights and you want to add in some cardio. So there's things that you can do. So that's what I would say. I would meet with a dietitian and or trainer and just see if they have any suggestions. Is Manuka honey okay as a sugar substitute for sporadic coffee use? I think so. I'm not a dietitian, so I don't know 100%. I do use Manuka honey myself periodically. I think it kind of goes back to what we talked about before. Moderation is key. If you're taking a small amount, I think it's okay. It also, I don't know if you have diabetes, but if you have diabetes, or if you have any other health conditions that can affect your blood sugar, I would talk to your doctor about it to make sure it doesn't affect that. But I think generally a little bit is okay. I think there was a question that disappeared about vegan treats. Are mini vegan treats with 3 to 7 grams of sugar okay once in a while? Sure. I mean, again, I think it's the same thing I feel like I'm saying this, it's moderation is key. Yeah. I mean, trust me, I definitely indulge in my sweet treats, but just try and do it in moderation and not overdo it.
Hi, Priya. Thank you so much for your thorough presentation. I think we have another question in the chat.
Okay. Let's see.
Also, if you have a question, please put them in the Q&A. It just makes it easier on us to keep track of them.
The one area I didn't address is the area of getting in touch with what is your purpose? 9-year pancreatic cancer survivor. Yeah, no, I would love to partner or speak alongside you too. I mean, first off, congratulations on being a survivor. I mean, this is a common issue that a lot of the patients that I see struggle with. It's hard because when you're going through treatment, you're doing something actively. And a lot of times patients will tell me that they feel like they're just waiting for the shoe to drop, right? Because you are constantly, many people are often living in fear that something's going to come back, right? And that's why my goal with today was to try and emphasize what you can control, right? We control what we can control, and we live our lives to the fullest. In terms of what is your purpose, I mean, that's a really tough question to answer, right? I mean, I think the question is your purpose to live a better life? Is it to serve others? Is it to, be the best at your job? Is it to be the best in your family? Is it to do a mix of those things? I don't know. Um, you could talk to a coach. There's life coaches out there, there's therapists out there. Um, Journaling can be super powerful, just doing that on your own. I think there's lots of avenues you can pursue that to help you find your purpose. If you
Thank
don't have, oh, can I keep going on the questions?
Yeah, no, I was just gonna
Okay.
point you back to that question.
Yeah. I have the chat open. So if you don't have the income for added services, what low cost or free resources are available? Yeah, so great question, because I think a lot of people are in that boat. I would honestly, I would start with the resources that I linked to. I am a big fan of the American Cancer Society. I think they really offer quite a few services that are free. But yeah, I would use one of those links. I would be cautious about what's online. I know some people will go on like Facebook, chat groups and things like that and kind of coach each other, patients. I think it's great to have support in the community. But I would encourage you to use resources that are tried and true and established. So you're making sure you're getting reliable information. Um, Yeah, that's what I would start there, and I would ask those organizations. I think that there's even when I was prepping for this presentation, to be honest, I was even impressed by how many resources are out there. So I would look at those organizations and start there. And then if that doesn't pan out, I would start with support groups too. Because if you're in, let's say, a breast cancer support group, you may meet people there that can point you in the right direction, or talk to your providers, your healthcare providers. Maybe they have, like I work with a dietitian who's on staff, and patients don't get, I put a referral in and they get a evaluation. So there's definitely ways that you can get help and get resources. Uh, yeah, thank you for sharing about the for a sense of purpose. I think yoga, just as a personal thing too, I think yoga and meditation can be really helpful as well. I think it can ground you. I mean, I've started incorporating it. I think it grounds me quite a bit. And when the world seems crazy and life seems crazy and unpredictable, I think finding ways to, spending time outside. I mean, even if you're not into that, just going for a walk or just sitting outside, it can be really nourishing, and restorative. So simple things like that can really make a big difference. And of course, to plug for Cancer Support Community is a wonderful organization that has lots of resources too. So, Abby and the team, I've worked with them for a few years now, and they're awesome. Like they can really also point you in the right direction of resources that you can tap into.
And then we have time for a few more questions. So we did receive a few questions during registration. So I'll go ahead and ask a couple of those.
Yeah, of course.
Um, Someone asked, how can I, as a healthcare provider, best support cancer survivors? And I know that's kind of general, but kind of any thoughts
How
on
can
that?
I, as a cancer survivor, support cancer?
Healthcare provider.
Oh, interesting. I like that question. I appreciate that the person is thinking about that. I think sharing your experiences, like from my perspective, I love it when patients tell me this really helped. Um, and tell your patients about this. Like getting the feedback of what helped you, I love that. And the other thing is like, I think patients help me by helping other patients. So for example, um, if I'm seeing patients in follow-up and they come in to see me in the clinic, they'll start talking to each other in the waiting room. Like I've had patients become friends with each other, and that can be a source of support too. And then I think also going to support groups, if that's something you're interested in, because I think a lot of patients who are actively going through treatment gain a lot of strength and support from those who have gone through who've kind of walked the road before, and it can really provide a source of inspiration.
Thank you.
Yeah.
And then someone else asks, how can one address health issues that seem to be after effects from radiation treatment?
I missed the first part. Can you say that? What about radiation?
Yeah, how can one address health issues that seem to be after effects from radiation treatment?
I would talk to your radiation doctor about it. It depends on what the side effect is. But sometimes we refer patients to hyperbaric oxygen. Sometimes we refer to physical therapy, sometimes occupational therapy. Lymphedema specialist. So it really we have to tailor it to what the side effect is. But I would share that with your provider. If you're not satisfied, get a second opinion.
Thank you so much. And that kind of answers this next question, this next and final question. But someone said they are 6 years clear, but their oncologist wants them to stay on meds and they want to try to get off of them. Do you
Yeah.
recommend they get a second opinion?
I'm a big fan of second opinions. I don't take it personally at all. Like if I have a patient who's going to get a second opinion, I think it can be very helpful. I guess I would be very careful about where you go for your second opinion. I'm a big fan of academic hospitals, which is why I've typically worked in that, like basically big medical centers. So USC, Cedars, UCLA, UCI, UCSD, UCSF. Just an academic place because they typically follow guidelines. I've had patients go to kind of like a doc in a box, and I had a lady who came to me who her doctor recommended that she just get vitamin C infusions and that would cure her cancer, and it didn't. And so I know that's an extreme example, but I would encourage you to make sure you're going to a reputable place, a place that's, Kaiser even, I don't know if I mentioned that, but there's lots of great hospital systems in this region, so you have plenty to choose from. But yeah, I'm a big fan of second opinions.
Thank you so much. And yeah, we have come to the end of our time together. I want to thank Priya once again. I know we all learned a lot and we are truly thankful for you being here
Of
with us
course,
today.
pleasure. No, thank you for having
Um,
me.
Thank you. And then we have one final closing slide. Jennifer, if you can share those. Perfect. Thank you. So if you would like to learn more about Cancer Support Community Los Angeles, please visit our website at cancersupportla.org. And if you have any questions or would like to get more information about how to get started with a support group or about any of our services, please feel free to email us at info@cancersupportla.org. And we also wanted to share one of our support groups that we currently offer. We have a post-treatment group that meets the second and fourth Tuesday of the month. And if you'd like to get more information on how to get started, you can go ahead and scan that QR code, or you can also feel free to email us. I want to thank our attendees once again for being so engaged during this webinar. And Priya, thank you again for being here with us. We hope to see you all at a future webinar. Thank
All
you.
right, thank you all. Have a good